Mr. Karthikeyan Elangeswaran. He is a social impact practitioner and sustainable development professional. He processes different kinds of fields in sustainable development investments, CSR impact investments, and not-for-profit sectors for corporate sustainable development. Mr. Karthik has done several assessments within India, Jordan, Oman, UAE, and Europe. And his main expertise and the presentation that he will be discussing now would be social return on investment and the evaluation practices. So, Mr. Karthik, I would really like you to explain the entire concept of SROI, social return on investment, in basic fundamental details, so we have the audience also understanding this concept for the first time. So, Mr. Karthik, over to you. Thank you very much for joining us. And Brijesh, बहुत धन्यवाद, and thank you so much. Please share with me your video so I can drop it on the chat for all the participants. Thank you.
Hi, everyone. And I thank Vivek and team to give me this opportunity. Is my screen visible, Vivek? Am I audible?
Yes, perfectly fine. Can we see you and also can see the screen? Thank you.
Great. To everyone, we will basically touch upon a lot of these things today, and I won't guarantee you that you will be able to go with the complete understanding of SROI as a tool or as an approach, because SROI needs to have quite a lot of field level experience, and there is a lot of study to be conducted on a ground level to understand how social values or social outcomes have to be understood. I mean, you will know when I start explaining the concepts, right? So I want to set the expectation that, I mean, I will try to present it as effectively, as intimately, I would say, but I would give you the hope that, I mean, you will understand in future, but you won't be able to grasp everything today, because usually it takes a 5-day workshop. Vivek and his team have been part of that, and we have been part of few studies with also Ambuja. So you'll be able to know how much it takes time to understand the concept itself to implement. If any one of you have been an auditor for a financial firm and conducting a financial audit, then you know, to conduct a financial audit through a workshop or through a half-an-hour session, it's not going to be easy, right? I mean, there will be a lot of gaps. So I'm setting the bar low there so that we can achieve high at the end of the session, right? So the overall aspects we are going to cover today is to have a background about SROI and how we are going to engage with them. And if you're going to have indicators to it, you're going to monetize it, and how you're going to establish it, right? These are the concepts we are going to address today. How did SROI start to come? There have been CSR managers, there have been foundations, there have been investors who have been investing in various projects, which is very social outcome focused, and there have been governments working on it, right? When I say CSR managers who get money from the CSR budgets want to implement projects. So they want to know what is the social outcome, what is the financial value of the social outcome. NGOs and foundations also do that. They too want to know the accountability for the money they have been given, right? And investors who invest in projects, let's say like in a vaccine project, or even giving few medical supplies, right? So they need to know what is the social outcome of it. Getting a vaccine is not just getting someone healthy, right? After getting healthy, how he or she becomes, you know, a more employable person, how he or she can educate herself during her course completion, how he or she can, you know, perform her duties in the household, right? So they want to know the social outcomes of it, and so does government. Government have become very sophisticated now to invest in social programs, so that they know the money they invest. For example, India's nutritional program, Poshan. If they invest more in Poshan, then they believe that they can avoid at least 30 to 40% spending for malnourished childs in the public health facilities. So similarly, there have been a lot of government studies conducted on tobacco prevention among teenage kids. So if X amount of investment goes on tobacco prevention, Y amount of spending is avoided in the government healthcare for throat cancers or lung cancers, for early tobacco smokers. So there have been quite a lot of reasons why the study has been started. So it comes from different stakeholders of the society. The concept SROI is started by Social Value International. Jeremy Nichols aptly puts that the interest in impact measurement within the foundations itself reflects a growing interest among sectors, right? I mean, the interest is just growing, and this statement he has given it in 2012, and it's growing on and on. If you just go to the SRO reports database, you'll be able to see the number of reports that getting added. And SRO is one of the impact measurement frameworks. There are multiple frameworks similar to SROI. There is a B Corp certification, B Impact Assessment Framework, and there is a Global Impact Investment Rating System, which is similar to that. And there is GIN, Global Impact Investing Network. And you have also UK DFID frameworks. So there are multiple frameworks. I will share these slides to Vivek. You can have a look at it, right? And since now we have seen why you need it, but how people are using it when they are having programs to plan. If they're going to launch a program, they want to plan for it. They want to know where the social outcomes could be, what could be the level of the outcomes, right? So that's more of a forecasting, more to understand the future, right? So if I'm going to invest in a tobacco prevention program, I want to know how many of the children in my community are potential targets for that. How many of them could be turning into antisocial elements in the society? How much should be my investment? How much should be my awareness program on a daily basis? How many staff I have to have, right? So you need to have an entire gambit of understanding about the investment. So it is very easy to plan for your future programs, SRO would be a tool. And assessing your existing programs. If there is a women empowerment program, if they want to work on, let's say, digital literacy and giving vocational training to women, so they want to assess that. So they will be able to use SRO as a tool and benchmark against social investment. I have worked across 6 SRO studies only for Ambuja with their skill development program, their agriculture and watershed program, and also one of their healthcare interventions program. Right. So if they want to understand which one is doing much better, whether the healthcare is doing much better, or do I want to go more investment in that? There has been a beautiful conversations between me, Pearl Tiwari, Anaga, and the entire Ambuja ACF management team, and even the Ambuja Cements top leads. So you will be able to understand how investment can be used through SRY, and it was helping more in their M&E process rather than in their investment, which is a different conversation. We can discuss that later. And SROIs, you also used to compare programs. If you have an X healthcare program and a Y healthcare program, how both these programs are doing. So it is very important to understand SRO in the context of various valuations they have put in, various assumptions they make in, various subjectivity it brings in. And these elements make it complex. And that's why I said, I mean, it's not very easy to understand in a half-an-hour session, but let's just kickstart, right? In simple terms, what is an SROI? SROI is a social return on investment. Right? So for every $1 spent on an initiative, the value the community program generated as a dollar, right? That is actually the social impact. So for every $1, if $20,000 is invested in a community and $50,000, I mean $500,000 as created as a social value, then it is 1 is to X times what you have for 20,000 is to 500,000, right? So there are 2 types of SROIs. One is evaluative, other one is forecast. Evaluative is the one you do for an existing or a completed program. Forecast, you do it before you start the program. Like I said, I mean, before I start a tobacco prevention program, I want to reach out to a prevention of 20% reduction in smoking among teens in the, let's say, in Andheri East. So then I'd be targeting so many schools. Then I would be planning for so many non-school going kids. So I would be planning all of this. So SRO would be very, very helpful for me to do that. We will discuss that as you come to know about it. And like any evaluation methodology, SROI comes with its own principles. These principles are the Bible, the Quran, and Bhagavad Gita, whatever you believe in, right? So when you want to conduct SROI as a methodology, it has to start from the bottom. You have to engage stakeholders. This is not you do something in your desk and you forget it, right? You have to go to the field, you have to meet the stakeholders, you have to discuss it, and you have to understand what is happening on the ground. Like I said, like a financial audit, you see the documents, you see the numbers, you should see the material, you should see the change on the ground, and you should value things matter. When I say value, it's getting a financial value, but giving a financial value is going to be very difficult, and that's what this whole session is going to address for half of its time. So value the things that we deal. I mean, what do you give a value for a confidence of a person? What do you give a value for a trust of an organization? What do you give a value for opportunities to get employment? What do you give a value for, let's say, getting water from a quality source, right? So how do you understand all of this? And I mean, you'll develop this in process. These are like the principles, right? I mean, you have to use values that comes only in a recognized format. I mean, everyone has to be having the same understanding about that, and you have to include only what is material. In a sense, when you are evaluating a project, you get excited and you find a lot of social outcomes, and you may feel, hey, this is important. This is indirect benefit. This is direct benefit. This is very useful. No, just take the top 5 or 7. Right? I mean, whatever you'll be able to visibly see it, and you'll be able to make a clear documentation out of it, and your stakeholders really value that, then those should be there, and do not overclaim it. And it's obviously a challenge. It's not like if you get a one gram of gold is 20 rupees. I mean, 200 rupees or 2000 rupees in the market. It's going to be the same pretty much. Or if you have to go across different parts of India, maybe it might vary by 100 rupees or 200 rupees. But the gold standard is the gold standard, right? Similarly, the petrol, right? You won't have a major difference if you put it in Mumbai or you put it in Goa or you put it in Delhi, right? I mean, maybe there might be a 3 to 5 rupees differences as per the taxes and other factors, right? So you have to have a pretty solid claim. You can't have a different claim for different financial values. So it's very important to have a specific claim. You have to have a common understanding. And very importantly, these are similar to the principles of a financial audit. If anyone has understood the principles of financial audit, this is pretty much the same. You have to be transparent. You have to give the data trail. If you're saying, 1 liter of water is being procured more at the closest source, and you're giving a value of, let's say, 5 rupees, and why you're saying it 5 rupees? Because 5 rupees is the value the stakeholders reported. And how you're sure about it? Because that's the nearest, tanker supply. The lady gets it as a 1 liter of water for 5 rupees. She gets it. And then you're so transparent about your data trail. So you're able to have ground level information. You're able to get a stakeholder consent, and you're able to document it and present it. So that's how you present your transparency, right? And verify the result, right? So for example, if you're being part of the team and you want to audit and you want to validate the findings, you have to speak to the team who has conducted all of this. It's very important to verify these results. If it comes from your implementation agency or anyone who's going to work on this, then it's not important to go on the ground. You have to go on the ground, or you have to validate it, especially if this gets into assurance. I just like to take a pause here. Is there any questions so far? I don't want to be pretty monologue here. Let's have some questions taken. Vivek, any questions from the audience? Am I audible?
Yes, you're audible, Karthik ji.
Thank you. Okay. Someone has raised the hand. I mean, Prince Kumar, you have a question to ask. Okay, I'll go to the next section.
Should anyone have questions, please, I would request them to put it on chat.
Yeah. Okay, let's get into the SROI approach. right? There are 6 stages in the SRY. And first stage is establishing the scope. What we mean by scope? If you're going to conduct a study, you have to know what is the program you are going to evaluate. For example, what Brijesh was saying is on the water related projects, right? I mean, if you're going to go for a water related projects, you have to know how many villages the program covers. What is the capacity of the the program in terms of number of lakes they have worked on, number of water bodies they have worked on. And you have to be sure in terms of the outreach, in terms of the beneficiaries, right? Who are the stakeholders being involved? Is it just the farmers? Is it just the drinking community? Or is it going to be even animals? Or is it going to be particular institutions who are going to be involved in it? So you have to be very sure about your scope and the stakeholders, right? And then you have to talk about the outcomes. I mean, Rajesh has talked about beautiful examples of, water literacy. Water literacy itself is an outcome, right? I mean, when the community understands about the level of water they need, the quality of water they need, the quantity of water they need, and how water cycle is actually, right? I mean, when the water gets dried up in the summer, how it gets replenished. What are the sources below the surface where water goes into, right? And how water is actually managed. So these outcomes you identify as a part of your evaluation, right? So once you identify that, you try to give a financial value to it. Like I said, if it is going to be a 5 rupees a liter for that individual in that particular village, then you have to be very sure about it, right? And then you evaluate the impact out of that. I mean, water can be just seen as a water for a drinking purpose or domestic consumption, but water can be a reasons many women couldn't get educated. Many people can't live in places, leave their family and go. So there are red districts in Rajasthan where people have been asked to leave, considering the crisis, right? And that's what Prajesh is totally talking about, Nagpur and above. And it's very important to understand how outcomes have been mapped and how a value are going to be built, right? And the remaining parts are pretty much mathematical. But it's very important to understand the first 3 stages, then you can go to the 4th and 5th, 6th stage. SROI comes with a very log framework. The log framework is you give inputs to a program. The inputs would be money, time, in kind. These all could be not just from a funding agency. It can be from anyone who's going to be part of the program, right? I mean, it can be from the community. As Brajesh was talking more about the lakes or the water bodies, a lot of them are being taken care of by the community by themselves, right? I mean, it doesn't have to be completely by Adjustment Foundation by itself. So it makes sense to include all the inputs that goes into the program to make it successful. And it is all looked in stages. When any activity is performed, you invest your time, you invest money, or give some kind of a material to start the intervention, right? So those becomes your inputs. And then what is the first level of change? The first level of change is you start getting a training, you start being a part of a campaign, you start doing some activities around that. So the results of that is your outputs. That's the first level of change. Outcomes are the second level of change. After you are under training, after you, let's say, brought people, after you even constructed a lake, after you cleaned up a lake, after you get trained on, what happens? You get educated, right? You have a clean water body in front of you to drink. You have more women who can go to schools, or who you have created a workforce around you, right? So there are third level of changes or second level of changes after your activities or trainings and events. That is your outcome, right? Here in this case, for example, entrepreneurs become more knowledgeable on management of startups, right? I mean, they are entrepreneurs who are running the startups. They are able to understand the market risk and opportunities, right? So that they are able to raise more funds. So the way they say that after they attended a workshop, they're able to understand the market risks and opportunities, they are able to raise more funds. And that's how they consider themselves to be more confident and skillful. So this is an outcome of a entrepreneur. It's an example there, right? But how are you going to measure that? To measure an outcome, how you need to have more indicators to that, right? I mean, that's how SROI functions. SROI functions on an output and an outcome. For each outcome, you have to give indicators. You can give 1 or 2 indicators, but at least you need to have at least 1 indicator to that, right? So if they say entrepreneurs become more knowledgeable and are confident and skillful, how are you going to give the financial value to it? Or what are the indicators to it? In this example, we can say entrepreneurs are able to run a business. This is a very qualitative judgment. Yes, no, you can give it a Ritter scale, right? Then entrepreneurs are able to raise investment funds? How many of them are able to raise investment funds? And entrepreneurs are more confident skilled. These are the indicators. Some of them are very qualitative, some of them could be quantitative. But it's very important to ask this to the respondents or the beneficiaries of the program. Only if they're able to confirm all these three indicators, then you ensure that that particular respondent is knowledgeable on management of startups, or that social outcome has been achieved. Right? Once you identify the outcomes, for example, if you have identified outcome, you have to give a financial value. There are different ways to give a financial value to it. Let me just move this. So there are social value of non-traded goods. So we are going to estimate those values. We are going to identify those values which are common, which are easily understandable, which are published values, or we are going to apply certain economic concepts. If you want to actually understand SRY, this is the beginning. I mean, this part is very crucial. There are different monetization techniques. One is stated preference and contingent valuation. It is called as willingness to pay. If I want to have a moment of happiness, how much I'm willing to pay, right? So it is on a context you're going to ask. For example, if I'm in a resort, I want a moment of happiness, how much I'm willing to pay. If I'm in my home, I want a moment of happiness, how much I'm willing to pay. So you might wonder, what is it? Okay, if I'm in a restaurant, I want to have an ice cream. Am I willing to pay 200 rupees or 500 rupees? If I'm in my house and I'm with my family, I want to enjoy a movie. Would I be willing to pay for a one movie price, or would I be willing to pay a Netflix subscription? Right? It depends. So you have to give the context very clearly. In the case of Rajesh, if they want to have a clean drinking water, how much the community is willing to pay? And again, you should know in terms of their consumption. If you're going to evaluate a program for a year, you have to understand the value of the outcome in a year. So how much the community would be willing to pay for a clean drinking water? But is that going to be the only question? You should ask how much the community is willing to pay at a closer distance of a 10 minutes walking distance, would they be willing to pay? Right? So when you say a value of 200 rupees, would they be okay with that? Would that be a rational one? You have to explore options, right? And that's where market value comes. So if a government municipality is laying a pipeline and if they're supplying a water at a particular rate, so what is the cost to that, right? Maybe it could be a 4 rupees. Or if there is a nearby water ATM installed by a different private agency and they are giving it a rate of, let's say, 10 rupees. Government agency is giving it 5 rupees. Why don't you take 5 rupees as a minimum value, which can be nominal, right? And then there is a hedonic pricing. Hedonic pricing is having multiple valuation under one. For example, giving a clean drinking water at your doorstep, giving clean drinking water at a more packaged water bottle to use, right? So there are multiple value additions you give to that. So when you are giving a water to a person in a house, you give it them at a doorstep, you give it them at a very consumable packaging, right? So then you add multiple values to one particular outcome, and then you have value. So you might give 5 rupees just as a stated preference, but if you give multiple values, would they be able to accept that, right? So that is hedonic pricing. Then there is a travel cost or time value method. For example, if the nearest government community tap is at a distance of half an hour, and they go in a, let's say, in a auto rickshaw and bring 3 or 4 syntax cans in 4 trips, and that becomes a cost of 400 rupees a week, and they are able to spend that 400 rupees for 8 members, and you're able to value that, right? So this is travel cost. The amount you spend to travel, the amount you're able to have it for a particular family member. So you're able to value that consumption of water for your travel and the consumption and the quantity of water you're getting it from them, right? So that's how you use a travel cost. So travel cost and market value are pretty much the same, but in travel cost, you would add the value of the travel through any commutation means you're taking. But in the market value, you're taking only the value of that particular service or the traded good. Similar to that, you're going to apply, right? I would give examples and I would take questions after that. For example, improvement in empowerment among women, right? So in the entire watershed program, we found that there has been women empowerment. When Brajesh was talking, he was telling that, I mean, women, used to fetch water, and that hassle has been reduced, right? So when you say that, how does it actually make a change? Maybe they have more time, and they work with the livestock around, and they're able to make an earning while they're being enrolled in Amul Dairy or other milk cooperatives around. And if they get that amount and they get to spend whatever they want, and if the house allows that, and they become an empowered women. So what is the financial value of that? So percentage of women who have been empowered, right, among them who has the authority to spend and decide on family expenses. Those are the women who become empowered, and that is the financial value, right? So average increase in family income among those women, right? Only those women's expenses or those women's income has increased. So only that particular value we consider as improvement in women empowerment, right? And for example, out of the village, 20 women are interviewed, and 8 have said this. For the entire village, only those 8 women have added a social value, right? So that's the value we take for it. And again, in terms of, let's say, improvement in health and wellness of the crops, right? So in Brajesh's case, he was talking about water salinity, right? When there is water salinity, then the crops doesn't grow well, right? Because you need certain quality of water at a pH scale to grow. Then if it grows well, or if the salinity is being reversed, then there is a higher, increase in productivity. As a result of increase in productivity, there is a increase in income for the farmers, right? So the farmers will be able to sell at a much higher quantity, and they'll be able to earn more, right? And that is considered as the value of improvement in health and wellness of the crops, right? I have given 2 or 3 values here pretty much in terms of the, let's say, market value. But in this case, if you present these concepts, right, to the stakeholders and they agree, and that becomes a stated preference or a contingent value, right? Are you able to follow me here? So this is the concept you need to understand. I'm going to pause here and I'm going to take questions.
Yes, Karthik, thank you very much. It's really nice to know that SROI is a tool to help quantify social, environment, and economic value. And I understand the ratio is net value of benefits with net value of outputs. Now, Karthik ji, number one is I would my personal question to understand is, can NGOs go with SROI, or it has to be only corporates?
Sorry, your question is, can NGOs?
Yeah, correct.
Can NGOs do what?
Can NGOs have an SROI report for their intervention?
Can NGOs have a report of their own?
Yes. Yeah. So it's applicable to all types of organizations.
Yes, I mean, see, SROI is a concept as similar to a financial audit, right, or a financial evaluation, like any annual report that you're getting it. At the end of the day, you can do a social return on investment for the investments you make on a program, right? So let's say even the vaccination program, or the Dettol. Dettol is a very commercial product, right? But Dettol has its own health purposes, on health benefits us. So in that case, if they want to do a social value of that, then they'll be able to do so. And especially if they want to do it in a COVID situation, right? Because even if you look into a lot of ads that, Dettol even kills COVID virus there. And they've claimed it, and they've done quite a lot of, health audits on that. What I'm saying is, it's also possible for a for-profit organization, for non-profit organization, anyone who believes there are social outcomes or social benefits out of their investments, then it is logically possible for them to do a SROI. And you may not require to do it every year, but at least once in 2 years, or you can have indicators to track.
Also, another question is, what are the streams of education for youngsters should they want to pursue a career in or be an auditor in for this SRO?
See, wait, let me resume the sharing. There are courses conducted by Social Value UK or Social Value International on SROI, right? I mean, you can enroll that and you can start at different levels. And it has been taught in various management schools now as a part of either social entrepreneurship or sustainability management. So SRO as a methodology has now become part of any social worker programs or part of social entrepreneurship and sustainability management. But if you really want to take on a professional level for evaluations, conducting impact evaluations, you could go to Social Value International and log in. But unfortunately, in India, we don't have a Social Value India chapter. I mean, you and I have been part of that to try to bring it to India, but we couldn't. The answer is that you have to go to UK or Dubai or Singapore or Canada to get yourself certified. Now, I mean, post-COVID, we have become very lucky that they have become more friendly to offer online certifications. I mean, so you can even try that, but you need to conduct an evaluation for that, and you need to present a case. And your initial evaluation doesn't have to be a heavy-duty assessment. Your initial evaluation can be for even a 5 to 10 program beneficiaries. Even if you think an NGO next to you is working on, let's say, street children or on orphans or on even pet care, so you can take that as a case and you can speak to them. I want to conduct a study and this is what I do, and post that you can present it to the SRY board for Social Value UK, and then you have to pay at least, I think, £1,000 for that. That is in Indian value should be £1 lakh or something. So you can get enrolled as a basic practitioner, and for advanced practitioner, accordingly, you can get it.
Another short question, Karthik.
Yeah.
Since you've been working for the past almost, I think, several years in this segment, could you share 1-2 memorable experiences of your auditing for any multinational companies? Because I remember that we had a site visit at Ambuja Cement, and they had considered there's water neutral. So do you have 1-2 case studies where you would like to present? A short 1-2 liners also would suffice.
If you want, I can just show a few materials. Just give me a moment.
Yeah, sure.
Able to see my screen? Okay. This is me actually. So this is a program we have conducted with Ambuja Cement Foundation. Let me just get into. Okay, but long story short, I mean, this is one of the largest studies we have conducted in India. This is for Ambuja Cement program, Ambuja Cement Foundation's Skill and Entrepreneurship Development Institute. The best thing about this is one of the reports where it has been assured in the world. I mean, you get very few reports that is assured, and it's been assured by Kasturi Rangan, who is part of Harvard Business School, and he's one of the pioneers in social development sector. Anyone who follows Stanford Social Innovation Review, SSIR, I mean, he's one of the writers in that. So this report we have conducted across 6 to 4 cities in India: Chandrapur in Maharashtra, Kodinar in Gujarat, Chirava, Nagaur in Rajasthan, Dadri near UP, and Sankrail in West Bengal. So you see, we have covered like 4 to 5 states in India, and here we were able to, see the program across different training sectors. There are retail, pharmacies, two-wheeler mechanics, local electricians. So there are many vocational courses being given, and these locations, when we traveled, we were able to see, major economic upliftment has happened for individual and from the community. I mean, mainly for the families And there have been quite a lot of entrepreneurial initiatives that has been taken once they get out of the vocational course, and their knowledge on the technical subjects have been improved. And especially for the women who start to become, vocationally trained, they become more empowered, either because in terms of the household earnings or the decisions they make, and also as a part of family well-being, they give back to the family. I mean, we Indians tend to help the family a lot, right? So there is a strong family well-being. These are the major outcomes we found. And to give a snapshot, the SROI is in the range of like 4 to 7.3. But these numbers also come with certain aspects. This report is in public. You can just go. I just want to say a few things here. Yeah, if you look into it, the stakeholders whom we met as a SEDI team was Ambuja's team, and the candidates. We met their families. We met the certification agencies. We spoke to the employers. We spoke to the partners who, besides Ambuja, who's been funding it. We spoke to the local community leaders who ensure that, I mean, these people come. We also tried to see what are the other training programs similarly happening in there. And we identified these issues as important to the stakeholders. But these become the most material issues out of these 11. This become more scope. And we found that, I mean, 825 candidates were our actual sample whom we have interviewed. And I just want to say, I mean, so many quotes have been there.
Yes, Karthik, I think that is sufficient.
I will just these reports are in public, and similar for Ambuja. This is a watershed project we have worked on. This is again in Kodinar in Gujarat and Rabri was in Rajasthan. So Brajesh was partly touching upon these projects as well for you. So this we have done it around 2010. So you can see the difference between this report and this report in terms of quality of writing by itself, and in terms of assessment quality also. So you'll be able to see the principles being applied. So it is very important for you guys to have a look at these reports. And you can come back to me anytime with any questions.
Sure, thank you very much, Mr. Karthik. It's a pleasure having you on board and joining us at such short notice. I sincerely appreciate your time, and definitely please share with me the slides so I can send it across to all the participants and the principals involved. Thank you so much.
Thank you, Vivek. Have a great day. Thank you.